And this is more than just patient comfort, really. If you tape the skin up there, they're going to not like you very much. Especially since it seems like most of the people who do this are referees. You want a referee on your side. Okay. For this, same principle as the great toe, where the fan prevents something. So with an Achilles tape job, what are we trying to prevent? What motion? Are we preventing plantar flexion? We're preventing dorsal. We're putting them into plantar flexion because if you have Achilles tendonitis, when that gets stretched, when you go into significant dorsiflexion, that's when it's going to flare up. So you keep them pointed down. So especially in this one, it's going to be really tough to anchor with anything but a stretchy elastic tape to their calf because calves are very, very, they can greatly expand when they contract. Doesn't sound right, but makes sense in my head. And then another anchor down there. And what's something biomechanically to note about the Achilles in that plantar flexion motion and dorsiflexion? About the anatomy and the makeup and what goes on with this plantar flexion joint. It's a class 2 lever, so what does that mean? Go ahead, Morgan. That's okay. It's the most mechanically advantaged joint in the body. It's a very, very, very strong joint. If you think about it, you can find anyone on the street, you can have them do toe raises at their body weight. No issues. You can't do that with squat, especially with all levers involved. But very mechanically advantaged, so that means it has to be very, very rigid tape, which is why we typically use Elastikon. So, same principles apply. Make a fan. Can you hold me with that, please? Some people use one strip. I like to use at least 2, but I'll probably use 3. And once you have the first one, you just kind of measure them out. Hold that, please. Use your fingers. Strong finger right there. All right. So there's your fan. If worse comes to worse and you're at a high school and you only have white tape, you'll just have to use a lot of white tape. Or hopefully you have the 100-pound, 5'2" freshman that's not very strong. But again, it always makes sense to anchor to the distal first. I'll be creating this. So, just like the great toe, it's going to be really, really tough to really point them into flexion. They need to get into plantar flexion. They need to get in their shoes. They need to be able to do things. So it's going to be very individualized as to how much or how little you pull. There. And understand that this is elastic tape, so it will give a little bit, but it won't give as much. All right, dorsiflex. And one thing I was taught, this is something extra that you don't really need to do, but to kind of strengthen the tape, I just pinch it together and wrap around it. Again, this is something I learned in undergrad. Doesn't need to be done, but something I like.